So it is my honor to introduce Dr. Bernstein, board certified in child, adolescent, and adult psychiatry, as well as in integrative medicine. She is a delegate to the ACAP Assembly from her local regional council chapter of the Southeastern Pennsylvania, Southern New Jersey, and serves as committee liaison to the ACAP Schools Committee from the ACAP and from the ACAP Complementary and Integrative Medicine Committee. Dr. Bernstein is a clinical assistant professor of psychiatry and psychiatric medicine at the Philadelphia College of Osteopathic Medicine, a clinical affiliate in the Department of Child and Adolescent Psychiatry at the Children's Hospital of Philadelphia, maintains a private practice and consults to children serving agents, child serving agencies, including family court, foster care agencies, community health agencies, and K through 12 schools. I'm just delighted to have you be part of our community, and we look forward to hearing from you.
So this is my talk today, Disruptive Behavior Disorders in Children. I don't have any disclosures, no conflicts of interest. I do receive money from different things that I do writing-wise, but that has nothing to do with this talk today. This was the thing I created completely for this, although I have to thank Gene Arnold, because he did get me involved in writing a chapter which is not yet published in any of these journals, that has something to do with this topic, but I actually kind of took off in a little bit of different directions with this talk. So it's the circle is enlarged, let's put it that way. I also do peer reviews for NIH and SAMHSA, again, not involving this topic in the least. So this is our objectives for today. Environmental risk factors, the connection between environmental risk, what are some protective factors, and maybe some take-home points that you can use in clinical practice. So I'm going to start with some definitions very quickly. So again, I thank you, Dr. Arnold, because I had never thought about the idea of safe, effective, and cheap until we started writing these chapters together. And I am not going to completely focus on disruptive mood dysregulation disorder, but that will be kind of the center of this, our thoughts today. The definition of disruptive mood dysregulation disorder, somewhat controversial still, even though after a few years it's been around. Explosive mood, explosive outbursts. Is this also a mood disorder, and is oppositional defiant disorder part of it or not? And is ADHD part of it or not? And then conduct disorder may have some intersection, although not completely. But again, not so important for my talk today. Although it is important to think about when you're seeing people clinically in terms of what is affective dysregulation, what is irritability, and there is going to be a longer term study, probably more of conventional treatments from something called the ADOPT Effective Group in Germany. They're looking at what kinds of treatments. They don't have results yet, but it's very exciting to me that they will at some point or another fairly soon. So I'm going to focus on helping you understand what are some environmental risk factors. Hopefully not too depressing. It's a little bit depressing, but this is the world we live in. And then maybe some reasons for hope. So, why am I doing this talk today? And I'm going to go back to this slide just to show you there's so many things that are toxins and poisons. You could spend your whole day being afeared of almost everything. But some of the more worrisome aspects, so pesticides and heavy metals, and there's this intersection of the two, because when you have pesticide exposure and heavy metal exposure, they each make the other one even more toxic. So this is a child's brain on pesticides. Not what we want to see, not at all what we want to see. And this beautiful slide, I have the Brookings Institution to thank for it. There's a very strong association of elevated lead level and aggression. So that's some relatively recent work by Sears. But even copper and zinc, even though they are cofactors that are needed, if they're in a toxic amount, so think some kind of a plant that produces, batteries or other kinds of electronic kind of things, gizmos that require copper, zinc, cadmium, lead. Okay, so that area can then have elevated levels of these contaminants, we might say. And although the Environmental Protection Agency is supposed to regulate these things, there's probably not enough of those inspectors to regulate everything. Um, so it's a big problem. And this is a table from the American College of Obstetricians and Gynecologists, looking at prenatally the impact of these different toxic elements. And I'm going to talk about some of them in a little bit more detail. Fracking, just on almost every level, fracking is worrisome, but especially the air pollutants when we look at the impact on children. And it's not just what is prenatally, but it seems to persist later on with behavior problems. All these different toxins, we're going to talk a little bit more about them, but I thought this was a really nice table for you all to have. And I have showed that table to some families that maybe they're somewhat doubting. The impact of, I'm going to go back to this here to take a look at lead, for example, on the third column for neurodevelopmental impairment. So there are adverse associations even at the age of 8 years old. So that many years later, from prenatal exposure and then moving on into exposure that you have during the preschool period. So, it used to be, and Needleman was probably the first researcher back, probably, I don't know, it might have even been before I was born. I don't know. But looking at lead and ADHD and found a strict correlation with that. But there has been research since then showing that even the levels of exposure that were thought to be safe are no longer safe. So there really is no safe level. This is kind of akin to the idea that there is no safe level of alcohol exposure during the prenatal period. So, but low levels, even as low as 1.3 nanograms per deciliter. So that's really low. The official level of what is toxic is more like 10. So that toxicity really impacts how the brain functions in almost every aspect when it comes to attention, memory, executive function. So really very worrisome. And, something that we actually can do something about that one. So lead, we can do something about. Some of these other exposures, not as easy to protect your children, your patients, yourselves, but lead, we can have water that's filtered. We can try to not use leaded gasoline, of course, which is, not used anymore. We can try to get away from paints and other kinds of products that include lead. So now this is sort of the discouraging part of my talk here, see, because air pollution, you kind of feel like you can't do much about it. You can do something about it on, I guess, on a grassroots political level in terms of trying to reduce emissions and all of that. But in terms of your individual exposure, it's very, very hard. I don't think the N95 mask is an effective filter for these kind of chemicals. They're really very small. They're considered ultra fine. So, what is ozone pollution? What is an ozone action day? So that's, when you hear in the, they give you an announcement. If you have sensitive lungs, if you have asthma or other conditions, don't go outside. So that's basically what they call an ozone alert. Now, this is not the kind of ozone that I'm going to talk about later in this talk in terms of protecting the environment. This is ozone molecules that are close down, close enough that we can breathe them, not up in the atmosphere. So that the ozone, along with what we call, quote, ultrafine particles. So those are those really, really small particles. And again, even if the exposure is only during the first year of life, an infant, even at age 7 years old, we can see impacts of a negative nature on attention, memory, executive function, everything that we wouldn't want in terms of ADHD. Now, it's a little bit of a stretch, but I will make that stretch to expand that to disruptive mood dysregulation disorder, because when you have a young person who is not able to process their emotions, there are also probably underlying problems they have in just processing information. And then I also will touch back on this again, but in terms of other things that are in the environment that maybe you have less of an ability to modulate. So noise, like aircraft noise, noise from factory. So there's strong influence of that increasing aggression. I'm going to talk a little bit more about this as we go on, and maybe some things you can do about it. Now, here's some of the things you can do something about. Okay, so environmental toxins inside your home, inside your workplace. So that's what kind of dish soap you use, right? Really simple, but not so simple. So trying to use products that don't contain phthalates, don't try to stay away from BPA, and I think I have a slide showing that. So these are some things that you can actively do something about. So this would be, to me, this is poison. Although I am still so sad to see that when you go into a hospital setting, that is still something that is available that they give children, sick children. They give them Sprite. I shouldn't have said the brand name, but anyway, that's what I've seen, and it's very worrisome. So, and fast food, again, something that a lot of our families of children who are struggling use as an inducement. If you behave well, we're going to take you to, whatever it is. Uh, Very worrisome. So, this definitely has an impact of a negative nature on attention, focus, and even aggression. So we really want to encourage families to eat healthy, and I'm going to get into that a little bit more as we go on. Um, so again, back to the aircraft noise. So, and it's not just aircraft. So factory noise, other kinds of sources, the honking of the horn, right? So, intuitively, we all know these things don't make you feel good. They make you feel upset. But there is research to show that indeed it does cause negative impact on children's behavior, focus, attention, very strong association. So this particular study, they looked at um, the impact on reading. So they looked at children, um, uh, 2,800 children in Amsterdam, and they looked at Amsterdam, if they live near the Amsterdam airport, if they live near the London airport, if they live near the airport in Madrid, and then, how was their reading comprehension? How was their memory? How was their reading comprehension and recognition? And it was all worse the closer they were to the aircraft, that traffic noise, and also road traffic. So all of these same factors, very impairing. And even as much as only a 5 decibel increase in noise. So I just want you to appreciate that, because 80 dB is what everybody considers as the level that you need to put on, hearing protection. Like, when you hear with the jackhammers, when they're cleaning, when they're fixing the street, there's a hole there, and then with the jackhammers, that's 80 dB. But 5 dB, which is not that much, has an impairment for long-term memory and reading comprehension for children. So, this is something that we should definitely not ignore. And maybe there are some things we can do. Not all families can move to areas where they're not right up next to all that noise. But perhaps if there's a choice, if, we can encourage families, if they have a choice, to move to the quieter spot, even if maybe the house is not as big. So, those factors really make a difference. And in the United States, they also looked at children living in areas near Los Angeles airports, and they found the same kinds of correlation. They found that if they were attending a school that was right near the airport with a lot of noise pollution, if they insulated the school, those children had an improvement in their learning. So there is something we can do about the noise. Maybe not as much about the air pollution, except on a global grassroots level. But for the noise, we can, there are some modifications that can be done. Now, this is not to say that, again, our own indoor environment. Now I'm thinking about when you're at home, right? So the cell phone, the alarm bells, so why is this negative? So it seems like the sleep impact, worsening sleep, increasing anxiety may explain some of that. And again, um, we want to think about the kind of lighting also. So blue light, we pretty much know disrupts sleep, but do you know that the computers have mercury? If you have a child that puts their finger in their mouth, we don't know how much mercury ingestion could they get. Maybe they could get some. Very young children are now using tablets, and they're still in the oral stage. They're still putting their fingers in their mouth. And then, of course, that disrupted sleep, definitely we know that has an impact on attention. So now I want to talk a little bit about some positives, and I am going to kind of go back to one of the negatives, which I didn't talk about earlier, which is the indoor cigarette smoking. So we know that's out, right? That's definitely negative. But why is it negative? Increased risk of depression, increased risk of learning disability. And this is children who are school age now. We're not even talking about the prenatal exposure to nicotine, which we know correlates with activating certain genetic factors that predispose a person to ADHD. But even at an older age, if we can encourage parents not to smoke at all, because the studies showed that even if the parents said they weren't smoking at home, some of those children still were affected. So I think maybe they're not always telling us the truth. So just to encourage a parent to stop smoking, that one intervention might hugely improve the child's functioning. So here are some of the positives that we can maybe do something about. Sunlight, red light, soothing sounds, green spaces, blue spaces. So that would be like if you have water around you, clean air, healthy food, clean water, supplements, and then positive activities. So sports, movement, creativity, and spending time with animals. And I was going to say at the end, I should ask Marisol to hold the dog up, because just even seeing the dog, obviously interacting with the dog, touching the dog is good, but still even seeing the dog could have a positive impact. So in Japan, and I'm sure I'm not saying this correctly, but I think it's called Shinrin Yoku. They call it forest bathing. So you go outside in the green spaces where there's foliage, and you just sort of bathe yourself, and it helps. It gives you this feeling of inner calm. And indeed, the research shows that this is true. So residential green space is associated with improved behavior, and the corollary, the opposite really. So not having that access is associated with worse children's behaviors. And that's even when they removed maternal education, deprivation levels. So even if you took that away, which you would think that correlates. So that definitely is something that we can do something about. Again, we can encourage people to live in areas where there is green space. We could even partner with architects to try to encourage green space, and that's a new thing. I'm going to get to that at the end. But the architects are very, very interested in the impact their buildings and their whatever they're creating has on human beings. And then Yaunen, again, another study showing that reduced adolescent aggression. And this was a very, very well done study. They used the child behavior checklist. The improvement was equivalent to 2 to 2.5 years of behavioral maturation. So just think about that. A child who is, 10 years old, who is acting more like a 7 or 8 year old, being able to have them act more age appropriate. And then we also, and again, it's hard to tease out because sometimes these studies may include the impact of positive physical activity, which is a whole nother, I mean, I could go, that would be a whole nother talk on wellness and resiliency that I really don't have time to do today, but keep in mind that is related. And then just the impact of beauty. So, sunlight makes for the flowers, right? So, I'm going to talk about this in a minute, but why it's important that we want to preserve our planet. This can't just be a picture that you look at. And then blue spaces seem to have a separate impact. It's maybe a little bit hard to tease out because you could go to a place or live in an area where you have access to foliage, blue space, beautiful things to look at, that are the result of sunlight. But again, water itself, protective for children who have behavioral difficulties. So an inverse association. So this study, Anatoly, was in Barcelona looking at the association of having time in green space and blue space. So being able to literally go to the beach and play. So, everything our ancestors told us, our grandparents, go to the beach in the summer and play was really true. Children need that time to recharge, to soak up that beauty, that blue space, the water. There's just something about that. And again, a reduction, and this study was very well done looking at the SDQ, and they found very significant reduction in total difficulties, emotional symptoms, peer relationship problems, and pro-social behavior improvements when the children had access. And this is a very large study, an association study, but a very large study of over 2,000 children. So I just had to put this in there because this is my local wetlands, Ridley Creek State Park, and again, how important it is that we have access to regenerative, restorative environment. So nutrition, again, we could talk for a whole nother hour on just all the aspects of good nutrition. These are examples, these photos of my students learning nutrition. So we have a whole nutrition course for them, and they practice. Very, very exciting. Now I don't know if I can open this up or not within this. No, I guess probably not. Okay. I thought maybe this is a really beautiful table that I can't show you, but I'm sorry about that. Uh, which showed how um, all the different uh, nutritional foods that are protective of lead poisoning. So basically think, green, anything green, broccoli, collard greens, all kinds of any kinds of greens, because they're high in calcium, because they're high, some of them in potassium. All these things help your body naturally get the lead out. Okay. Mindfulness, although very good for a lot of things, we don't have any studies that have yet shown it to help disruptive mood dysregulation disorder. It does help ADHD, and it does help adults who have depressed mood. So we just don't have the power yet in the studies to show that. And I feel like I'm missing a slide, but maybe not. Maybe I'll get to it at the end. Um, Music. So music seems to be something also that can be a protective factor, improve children's behavior, not just ADHD, but also disruptive behaviors. Um, and then I guess I don't have a slide on this because I didn't have a great photo of an animal that I had privilege to show. But I just want to touch on the fact that not only music but equine therapy also seems to be promising. There are no large scale studies yet, so maybe that's why I didn't really do a whole slide on it. But I do want to talk about it anyway because it's very intuitively attractive. The studies for equine therapy are more related showing improvement for persons on the autism spectrum. Uh, However, there are some case reports of people using equine therapy for adolescents with disruptive behaviors. And there is a nice case report showing reduction of aggression with persons who have autism. So perhaps, that will be something that can be proven to be effective for DMDD in the future. The whole idea about what animals do when they're near people is that you get increased oxytocin, you have a lower heart rate, lower blood pressure, basically a reduced stress response overall. So that part all very, very positive. So now I just want to go through this really quickly because I want everybody to be fired up and want to do some political agitation because we really need to protect the ozone layer. I'm not going to talk about this with a whole lot of detail, but I'm just a picture's worth 1,000 words. So there's the CFCs. Um, and then, this is why the ozone layer is bad because you have the hole and then the sunscreen for the earth is gone. And so we have these UV rays where they don't belong. And then, this is why we have the melting. And, the chlorine is one of the big sources. And then this is the result. So this is what happens. So not only do people lose their housing, but they also lose their ecosystem. So, think about that. So that poor tree, that tree is probably not, I don't know if that tree is going to make it. And the grass, I don't know if it's going to make it. So we're losing all our positive factors. So there is some hope. The ozone layer looks like it is shrinking a little bit. Maybe by 2060. And overall, when we think about the impact of the climate crisis, it's just so unbelievably negative. So the psychosocial stress when people lose their homes, the impact on the environment when you start losing the ecosystem, and then, what do people do when they're stressed, right? They smoke more. So you have more exposure to secondary smoke inside and they're on their devices more and maybe they had to move somewhere where there's a lot higher noise level and air pollution and they don't have access to green space. So children are our future. They deserve a clean environment and I want you all to be advocates for climate change. And I'm very excited that the AIA, the architects are, they're on this. They realize how significantly negative the impact is. So these are my references. And you have questions. This is my institution. It really does look like this almost today because we are in close to the 60s here in Philadelphia. After last week, it was really cold and things are starting to bloom and they probably all will die off next week when it gets cold.